Austin. Okay. Okay. A few years ago, I used to babysit a kid named Austin who was 13 years old, and he had Asperger's syndrome. He was really intelligent, and he was really good with using like computers and phones and everything. He was so good that he even hacked the Target intercom system, like from his house. And he would also collect calls to his grandma from his landline, and he would hack his parents' eBay account so he can shop online. So he was a really smart kid. And my cousin Courtney, who's 16, has Asperger's too. When she was really young, she used to be like obsessed with animals, and she would just obsessively talk about it, and she could tell you anything about like any species you need to know about. And now that she's older, she has an obsession with Japan and anime and like those cartoons. But Asperger's is an autism spectrum disorder, and every case is different. It could be like a low case, or it could be like higher. According to Access Science, Robert Bird states that in the most recent study, 1 in 150 kids have an autism spectrum disorder, which includes Asperger's. I know firsthand because I babysat both kids, so I saw the symptoms and how the disorder is. It's important to listen because the disorder is increasingly common, and the knowledge of the disorder can help you deal with somebody who has it, and you know what to expect. And there's more people diagnosed than we think. I'm going to tell you about the symptoms, the treatment, and the management of this disorder. According to the National Institute of Neurological Disorders and Stroke, symptoms include obsessive interest in a topic, and that could lead to obsessive talking. Like in Courtney's case, she would talk about like anime and Japan and animals. Monotone speech or no rhythm in speech. I know Austin, when he talked, he was very monotone. Like you couldn't really tell if he was excited about something or not. Unable to realize inappropriate volume of voice. Like, they may be screaming, but they may not like realize that because that's just the way they talk. Isolation due to lack of social skills. With Austin, when I would bring my friends over to when I babysat, like he would just hide, and he wasn't really comfortable with it, so he just isolated himself. Developmental dysplasia and motor skills. They may have an active childhood, but they may experience depression in young adulthood. And also, along with the disorder, they may also have ADHD or Tourette's syndrome, depression, anxiety, or OCD. Doctors can diagnose this by seeing if the person has abnormal eye contact, lack of interest in peers or interaction with others, if they have a failure to turn when they're being called. They can be diagnosed by a team of psychologists, neurologists, speech pathologists, and psychiatrists. At least one of these symptoms arise by the age of 3 years old, and they use tests such as IQ tests, communication tests, and stress tests when they're old enough to be diagnosed. And according to Kate Goldfield, who's a blogger living with Asperger's disease, this syndrome, it's often difficult to make friends. Crowds, noises, and unfamiliar places may cause like fear and anxiety. I know for Austin, he has cousins that live in a very big house, and he doesn't like going there because he gets really overwhelmed by everything in the house. It's just too big for him, and he's not comfortable. People with Asperger's may have a normal IQ, or they may be extremely intelligent, but it's different in every case, and sometimes people may even lack common sense. They dislike superficial conversations. Like, they don't really like small talk, and it's not them being rude, it's just they can't handle it like as well as normal people. They could live like adults though, and they follow adult-like rules, and they can learn much faster than peers sometimes. But social factors such as like clothing and their appearance don't really seem to affect them much. When they care about a person, they're for the most part generally loving, but they're just not like comfortable with people they just met. But according to the New York Times, a series of programs that are started at a young age include talk therapy, so they can manage their emotions better, parent treatment, so the kids can learn at home and the parents can learn how to cope with it, occupational therapy that helps motor skills, social skills that are taught in groups, speech and language so they can carry conversations normally and learn how to deal with it. And medications can also help aid in the anxiety and depression that come along with it. According to Joy DeVry, depending on the case, a normal life can be led. They can, for the most part, hold mainstream jobs, and they'll get married and have kids one day. They typically have jobs in like engineering because their interest in technology just comes easy to them. As adults, they're looking at they're looked at as uncaring and selfish most time, but they're really not. It's just a disorder. That's not how they are. They don't mean to be that way. But for Bill Gates, Pablo Picasso, and Albert Einstein are suspected to have an Asperger's syndrome disorder, which actually makes sense because they're really extremely intelligent. But now that I told you about the symptoms, the treatment, and the management of the disorders, hopefully you can realize that these people are not weird or strange. They're just very intelligent and they're just a little different than us. And if you ever meet a person with Asperger's syndrome, hopefully you know what to expect and how to deal with the person now that you know a little bit more. And that's it.
Good job, man.
Good job, you did good.